One thing I've seen enough times online to get me kind of riled up is that people assess hip internal rotation, and if it's limited, they make this snap judgment that that's a structural problem, that it's something you were born with, possibly genetic. And that's just a big leap. A range of motion is a baseline, and oftentimes, or almost always for younger patients, it's malleable, it's changeable, it's a sign that we find, and then we have to find the root cause diagnosis of why you have limited range of motion and address it. So what I'll see is that professionals, clinicians, or fitness professionals will assess hip internal rotation in sitting by having the patient bring her foot out, or maybe they'll do it passively, and they'll say that's limited and say that there's this prescription that you need to do squats with your hips externally rotated because of this impingement or FAI or cam or pincer deformity or structural defect. What I find for hip internal rotation is that it's true, I find it often limited, but almost always for younger patients especially, it's a mechanical problem, meaning the low back joint's not moving well, so the hip IR is limited, or the hip joint's not moving well, so the hip IR is limited. So most times we can fix it quite rapidly by finding the movement the low back needs or the hip needs to move into to get it back on track and restore normal hip IR mobility. We learned that we want it to be 30 to 40 degrees, and I love it to be on the high part of that normal. I assess it more in supine. I like how I can assess it passively better there. But if you do it in sitting, you need to make sure that there's no accommodation. So the big point is this: it's a baseline. It doesn't mean that it's the way you were born. It doesn't mean that it can't change. So don't make a lifestyle modification, the way you do squats, etc., based on that. Find a clinician who knows how to take the baselines and then find why the baseline is limited. And like I said, unless you are over 60 and we're really thinking there's a strong likelihood that there's been a long-standing degenerative process in the joint, for younger patients, a limited range of motion is almost always reversible, and usually rapidly because it's a mechanical problem, and it can be a slower reversal if there's actually a tissue or capsular restriction. But for most people, I find it's mechanical in the low back or the hip joint, and therefore with one or two movements performed repeatedly, we can get that hip moving well again, and therefore when you do exercises like squats, you don't have to have this idea that your hip is just naturally limited.